And am I framed up okay for the intro?
Yes.
We just need to spotlight Liz, the other interpreter.
And Alex, if you wouldn't mind just getting that captioning link. There we go, right on cue. And then let me know when the attendee trickling has leveled off.
I think we're all set, Blaze.
Okay, super. Good afternoon and welcome to the September webinar in our New York Association on Independent Living, or NYAIL, and that is spelled NYAIL. I am Blaze Bryant, the communications specialist for the association. It's great to be back with you. And a couple of quick housekeeping things before we get started. Number one is the webinar is being recorded, and I will do my best to get it to you by the end of the week. Number two, the chat is disabled as a screen reader accessibility accommodation. You can put your questions in the Q&A box, and I will assure you there will be time at the end for any questions. Last and certainly not least, there will be a survey that will be going out in an email with the recording. I'm going to try and get it into the webinar before it ends as well. Having some issues with that. So, but the survey is very beneficial in terms of getting your feedback on the webinar along with the future webinar ideas. So with all that out of the way, we have Christopher Woodfill, who is the Executive Director of the New York State Office for the Deaf, Deafblind, and Hard of Hearing, doing a presentation for us today. So without any, and I'll just note this for anyone who has a visual impairment, Christopher will be or is utilizing an interpreter who will be speaking on his behalf. So it's his material, and the interpreter is conveying the information. So take it away.
Thank you so much, Blaze. This is Chris here. And welcome to all of you to the webinar today. Before we begin, I did want to first and foremost thank Lindsay Miller, of course. Thank you so much, Lindsay. And thank you to Blaze as well. And thank you to NYAIL for inviting us and to make today's webinar possible. I think today's intentions were twofold: to also introduce you to our office and to reach out to the independent living centers to inform them about our office, the New York State Deaf, Deafblind, and Hard of Hearing office, as well as Blaze and Lindsay have been working with myself and Rachel as well, who's here in our office. She is my interpreter. She's interpreting for me today for this presentation. The four of us have been working together. We developed a survey. That survey was sent out to all 32 ILCs here in the state of New York. We've asked some questions and we've collected information from all of you. Today, I plan on presenting the results of that survey. So again, to present our office, who we are, and also to present the results of the recent survey that was sent out. I'll speak more on that in a little bit, but very excited for this opportunity. Again, thanks so much to you, Lindsay, and for Blaze inviting us here. I'll start with introducing our office. And we will go to the second slide, if you don't mind, and we will show our welcome video. So go ahead and show that video.
Welcome to the New York State Deaf, Deafblind, and Hard of Hearing Office. Our mission is to support the deaf, deafblind, and hard of hearing communities across our state by removing barriers and ensuring equal access. We're dedicated to providing a welcoming environment where everyone is respected, affirmed, and empowered. We also aim to be your primary resource for all matters related to the communities we serve. We are a team of two, deeply committed to making a big impact. We've traveled across the state to connect directly with stakeholders and community members like you. The issues that matter most to you are central to guiding our work. The Interagency Coordinating Council, or the IAC, plays a key role in shaping our priorities. This 15-member council, which includes 8 community representatives and 7 state agency officials, works collaboratively to advocate on behalf of the deaf, deafblind, and hard of hearing communities regarding state services. As part of our commitment to transparency, we've published a comprehensive annual report on our website that highlights our achievements and outlines our future plans. This report offers an opportunity to see our progress and learn what lies ahead. Most importantly, we value your input. Whether you have questions, feedback, or need information about available state services, please feel free to reach out to us by using the information below. Your feedback is invaluable in helping us better serve your needs. We look forward to connecting with you.
Okay, great, perfect. Okay. That video is more like an elevator pitch, just a short snippet of the work we do and who we are in this office. But I wanted to elaborate just a bit more. So the New York State Deaf, Deafblind, and Hard of Hearing Office is part of the Chief Disability Office. Our office is within the executive chamber. And I'll expand just a bit more about the executive chamber. Often people hear that term, executive chamber, and they're uncertain what exactly it is and who they are, but it's very similar to the governor's cabinet or cabinet positions within a state. The executive chamber has different deputy secretaries that oversee and work with different portfolios. They have a chief of staff and chief of operations, state operations here. So there's a flow chart and a hierarchy within the executive chamber, and our office is within the chamber under the human service portfolio. So of course, it's a hierarchy and there's levels here, but that is where we sit. That's where we are working here for the governor and her executive chamber. It's important for people to understand different levels of bureaucracy. Sometimes offices are within an agency or, just to full transparency and to explain who we are and where we sit and the type of work that we do. That is important. Our office also oversees the IAC that was mentioned in the video, Interagency Coordinating Council for Services to persons who are deaf, deafblind, and hard of hearing. We just call it the IAC or IAC. Within the Chief Disability Office, they oversee the MISCC, the Most Integrated Setting Coordinating Council. I'm sure you're familiar with that council, and our office has our own council. Our council just focuses on the community who are deaf, deafblind, and hard of hearing. The MISC is to support people with all disabilities, but our council is really to support and focus on the deaf, deafblind, hard of hearing community. Lastly, our office, or the council rather, as was explained in the video, there's 8 members of the community that sit on the council and 7 state agencies. Just a brief update on the IAC. We have 2 official members who have been appointed to sit on the council. 6 others are still in the process, and it's taken quite some time to get people sitting on our council and to be officially appointed. And it's not because people don't want to. We have plenty of folks who are interested in sitting on our council and being a part of the work we're doing, but there's a process and there are steps to take that require, of course, background checks, so on and so forth. We haven't officially started meeting yet, but I'm looking forward to the day that we get to do that and continue to move forward to support our community and get more feedback from them. Even though our meetings for the council haven't started yet, Rachel and I are the 2 people here in our office. We're not sitting still doing nothing, waiting for the council to be established. Of course not. We are continuing to move full speed ahead and to develop the work that we're doing in the advocacy here in the state, and I'll continue to elaborate on that a little bit more. I mentioned just the 2 of us. It really is a small office, just 2 of us here. Myself and Rachel, who you can see as my interpreter. She works with me every day, and we service the whole state of New York. Quite a big task. But advocating on behalf of the deaf, deafblind, and hard of hearing community. Go ahead to the next slide. I did want to share our mission, our vision, and our value statement with all of you today to be familiar with those statements and what our office represents. Our mission, and I will read it, is to improve the quality of life and to break down barriers that prevent equal access for the deaf, blind, and hard of hearing members all over the state. Again, improving quality of life and making sure we have equal access. Number 2, our vision statement. is that we envision a world where deaf, deafblind, and hard of hearing people lead barrier-free lives and have equity with their hearing peers and hearing people in the state. That is what we envision. Lastly here, our value statement. It's important for all of you to know and to be aware of our office, that we value a welcoming and safe space for the deaf, deafblind, and hard of hearing people, a place for them to interact with us, to communicate with us, to feel respected and heard in this office. Our office is also a resource for anyone here in the state about anything related to the deaf, deafblind, and hard of hearing communities. I'll go back to the survey a little bit more, but when we often, read survey results, maybe people didn't know that they could refer to our office, but we are a resource, and that's one of the reasons we wanted to present to you today, to support your offices and your independent living centers. Okay, next slide. Just checking the time here. Okay. Our office has recognized 3 what we call meta priorities. Each priority I could elaborate and expand on a bit to help you understand where we came from and how we came up with these priorities. The first is access to language. That is the what language. It really depends on which community we're talking about, the deaf community, the deafblind, or hard of hearing communities, because their language looks different. The deaf community tends to use American Sign Language or a signed language, but here in New York and in the US, we emphasize American Sign Language. That is their language. The deaf-blind community uses a variety of ways to communicate in their language based on how they become deaf-blind. They may use ASL. They might be a culturally deaf-blind person who uses ASL in the limited vision they have. They might use tactile American Sign Language, or another language that the deaf-blind community is using is called pro-tactile language. That's emerged and has really rapidly taken off within the deaf-blind community. There are still some deafblind individuals who never learn sign language, and they still rely on English as their primary language. You'll see a variety of languages used in the communities that we serve and we represent, either ASL, tactile ASL primarily, and or written or spoken English. And they rely on potentially another language as well if they are coming here from another country. And each community accesses their language in a different way. Some hard of hearing people rather might access their language in captioning or in different devices. And I'll speak to that now. So access to communication is really the how. How do we get access to that language? The deaf community often utilize the use of a sign language interpreter. Sometimes they will see a translated document. It might be a video form, but often it's through a live interpreter or a recorded interpreter. A deaf-blind individual often uses an interpreter as well. It might be an ASL or a tactile ASL or a pro-tactile interpreter. I will also say and mention that there's some deaf-blind who rely on the hearing, the residual hearing that they do have, and they might access assisted listening devices or Braille, things of that nature, variety of assisted listening devices. And lastly, or I guess I should also make sure, because I did bring up Braille. Refreshable Braille displays are access to language, and that's how they communicate. Okay, so then going to the hard of hearing community, they receive communication mostly through, as I mentioned, assisted listening devices or captioning. Some deaf people do like to read captionings, of course, but it's important that we captioned videos, archive captioning our videos, use communication access real-time translation services or CART captioning. It's important for you to be aware of the variety of communication our community members, what they use to access their language. And lastly, access to information. That's the why. That's why we're talking about language and communication. They utilize that to receive information. Without having those devices or that language, they wouldn't have access to information. And if you don't know, you can't access services. That is one of the reasons why many deaf people or deafblind or hard of hearing people feel very isolated, because they don't have access to their community and access to the information that's available here at the state level. If they don't know because it's not in their language, or they don't have the communication devices to be able to access that information. So we've recognized the what, the how, and the why. I won't elaborate any more on that. You feel free to reach out to our office if you have any questions and you do want us to elaborate. We'd be happy to do so. That's what we're here for. So moving along in the, oh, hang on just one second before we jump the next slide. Initially, when our office was established, we were inundated with requests from the community. And we started to recognize all these different types of requests coming out. We started to categorize them. When you're in the moment and you're just seeing all these different types of requests coming at you, it's a flood of information and flood of requests. We were able to just kind of take a step back and recognize some of these are issues to access to language, and some of these requests are access to communication, and some of these are access to information. So we're able to manage and categorize the work that we're receiving and to be able to work on it. So we'll go on to the next slide now. This slide I will just briefly mention. The work that we're doing is not just the two of us deciding what to pay attention to, certainly not. We are in regular communication with our stakeholders, and we are not working here in a vacuum. It really is imperative for us to partner and to collaborate closely with various stakeholders here in our office. We learn from our stakeholders what's going on in their regions, challenges that they have, and barriers that they have. And we are able to prioritize based on those. We work together with our community partners to improve quality of services and improve quality of life, breaking down barriers and providing more access to the deafblind community by receiving from them and then hopefully giving back to them. It's a two-way communication, and we've continued to advance the work we're doing based on these partnerships. I mentioned the Interagency Coordinating Council, and again, I mentioned 7 agencies, state agencies are working in that council. You could take a look at our annual report and read about those agencies. But we partner closely with all of them and to make sure that their services are accessible to the community. And also sometimes they struggle with how to provide services. They want to be accessible, they just don't necessarily know how. So we're working with all of them. I mentioned the executive chamber partners. We have lots of portfolios here internally that we're supporting to make sure that the work they're doing supports our community as well, and we're not left and forgotten, but we're advancing our community's needs here internally. I had mentioned state agencies already, but we also work with many other state agencies who don't sit on our council. There's several other agencies. We have, in fact, 96 state agencies in the state, and we've probably partnered with 15 to 20 of them so far on a regular basis to advance our work and to support their accessibility within their state agencies. But the largest partners, or largest agencies rather, is who we're partnering with regularly. We also have worked in local government as well. Of course, the Rochester region has a large deaf community. So within Monroe County, we have worked there, and we also work closely with the Mayor's Office for People with Disabilities in New York City, the MOPD. So we have various state and local partners, as well as in the city, that we can work together with to advance the services and access for people with disabilities, and specifically deaf, deafblind, hard of hearing. I listed here agencies and organization partners. NYL is a great example of that. We've partnered with NYL to make sure that their services are accessible to our community as well. And there's various other organizations I could mention as well. Not only NYL, of course, but many other great organizations in the state who are advancing independence and communication access, and we are working together with all of them to advance the community. And lastly, I put community stakeholders and partners. That's individuals who are members of the deaf, deafblind community and hard of hearing community. We meet regularly with individuals or groups. And I will just jump to the survey, just add one quick comment. Often independent living centers will say, you know, I'm not quite sure who to reach out to for deaf, deafblind. Who's the community in my region, in my area? That's okay. That's totally fine. We're here and we do know who the community members are. We know the organizations in your communities. So we're happy to connect you and to support you with getting connected to your deaf, deafblind, hard of hearing communities in your region. Again, another reason to reach out to us, but we partner with all of these people all over the state to get input and to gain access. Part of our role and responsibility is to make connections for people, and that's been very exciting. We'll jump now to the next slide. Okay, I will no longer talk about just what our office is doing and who we are, but now I did want to spend a majority of the time talking about the survey that I had mentioned, but feel free to reach out to us anytime if you have questions about our office. Okay, this survey project just happened last month. We did meet with Lindsay and Blaze to talk about this idea and to learn more about what services are here in the state in independent living centers. So it's been a great time partnering with NYL to conduct this survey. The survey was really what we're calling a gap analysis to see what services are out there. And I'll show you some of the great services that are out there, as well as what's missing here in our ILCs in the state. Number 3, the results of this survey will guide our continued collaboration that we have here in our office and with NYL. We will continue to work with them to focus on results and to focus on the work that we can do. Lots of issues that have come up. It's just an opportunity. It's great to have the data, though, to prove. I mean, we can't just talk about what we think is happening, but we needed to reach out to all of you to have the evidence of what is there and what services are already established, and then what is in reality still missing, or what the gaps are in the services. It's so important for us to have done this survey because of really several reasons. Independent living centers, we have recognized that they are the front line for our community members all over the state. New Yorkers are coming to the ILCs for services. Often the ILCs are really, there's just one organization or one association providing those types of services in certain regions. That is the place to go to. There aren't any others in certain regions. So we want to make sure that the deaf, blind, and hard of hearing communities also have access to those resources and services. It's imperative that they do, because you are the front line interacting and supporting our community members. If we don't incorporate and include the deaf, blind, hard of hearing community members, where else are they going to go? We have to make sure we're linking them to services and linking them to resources as well, just as they're hearing New Yorkers are receiving services and/or benefits. That's the goal of the work we do and the goal that the ILC should have as well. That's the why of the survey. Lastly, here on the list, we have been able to identify opportunities and also outreach opportunities for ILCs in their own community members. Some ILCs have already partnered with deaf, blind, hard of hearing community members, and they're doing a great job. And other ILCs responded that they don't know who's out there, that they're not really reaching out and getting connected with our community members. And maybe the deaf community is not reaching out because they feel it's not accessible. So we have been able to recognize some opportunities and need to take advantage of those opportunities to support our community members and to provide accessible services to them. Sometimes our community members don't know that the ILCs are there, and sometimes they do, but they don't know if they're accessible or not. So it's important for us to communicate to our community that you all are out there and providing services and resources to them. We often do refer your offices when people reach out to us about, what services are there for housing or transportation. We often say, contact your local ILC. So we want to make sure the services we're referring to are accessible to them. We'll go to the next slide, Lindsay. Here are some of the results that we saw from the survey. Again, there's 32 independent living centers in the state that are members of NYL. And it was NYL who sent out the survey. It wasn't from our office, even though we worked together to develop the survey together. It was NYL who sent it out to all of you and the ILCs. NYL also collected the responses, and then they sent them to our office to analyze and to take a look at the results. So here they are. 14 ILCs out of the 32 responded to the survey and filled it out. That means obviously 18 did not, but that is about a 44% rate of response. In the survey world, it's actually pretty good, 44% return rate. I think most have a 15 to 30% response rate. Anything above that is considered a good response rate. I always, of course, like 100% response rate, but that's okay. 14 of the ILCs responded, and it gave us enough information to look at the landscape in the state and the ILC services that are happening or in fact not happening to support our deaf, blind, and hard of hearing community members. We did receive a lot of good information, and we'll share that with you now. So within those 14 responses that we received, 7 of them had indicated they do have a dedicated program that serves our, we'll call DDBHH for deaf, blind, hard of hearing community. So 7 out of the 14 do have a specific service I was happy to see that there were, in fact, 7 who had very specific services. And the other 7 responded, we do not have a specific program for our deaf community here in whatever region they're serving. Those 7 who said we don't have specific programs, we do though have individuals in our team and in our office, our centers, who can still work with the deaf community. Not a specific program, but they do have staff who are able to communicate with the deaf, deafblind, hard of hearing. 10 of the respondents are considering or planning to expand the services that they offer to our community members. Which was great to hear that there's 10 who are interested in increasing or planning to expand. And 4 said that they're not. They do not plan on, expanding, and that they're good with what they have. The last point on the survey that I will mention is that none of the respondents did indicate that they had to close down their deaf, blind, hard of hearing services. So it's out of those 14 who responded, none of them said that they needed to close down services. Again, that was from the 14 who responded. We'll go to the next slide. So this slide speaks to the question that was asked to those 14 who indicated that they do have various services or programs available, specifically to the deaf, blind, hard of hearing community, not just all the services, but specifically to our community. And those services would be on top of the regular types of services that are offered to all hearing disabled community members. And I'll mention them here. Some of the ILCs offer trade services, the technology-related assistance for individuals with disabilities, or trade equipment loan services. They have them set up all over the state, and certain ILCs do have those equipment loan. I know not all ILCs have, but many of them did say that they have equipment loan distribution, which some of their equipment does support our community members. So that was one. Again, it's not just for people with disabilities, but specifically for our community members. Number 2, another one was ASL and CART captioning services. I think that there was 4, maybe 5 of the ILCs that provide ASL interpreting services, which is a fee for service, but that money that they collect as the service that they have, the ILC interpreting services, that money supports the remaining services within their ILC. I thought that was interesting. They're collecting money by running an interpreter agency basically within the ILC and supporting other deaf, blind through that. I just thought that was quite interesting. Maybe it's an opportunity for others to do something similar within their own ILCs. Just an idea. I think that there were, again, was 4 or 5 who did offer such a service. We'll talk about funding and sources of revenue in a future slide, but you could through ASL interpreting or CART captioning services as well, if you are providing that type of service, a fee for service. It's communicating and providing communication access, but it's also generating some revenue, which is great. Of course, advocacy, number 3, lots of the ILCs have advocacy work that they specialize to support the deaf, blind, hard of hearing community in various areas. So again, there's lots of different types of advocacy, and that's on top of like their regular advocacy, what they do for people with disabilities in general, but a level of enhanced advocacy for the deaf community. And number 4 is referrals to services. Some of the ILCs really can't do a lot of advocacy themselves, but they do refer to other organizations within their region who are doing that type of work. And that's really great. That was pretty common with what we saw in the survey results, that they're referring out to other agencies who can support the deaf, deafblind, hard of hearing. And we'll explain a little bit more about that. Number 5 here was support groups or task forces that they have established. Again, those are specific support groups specifically for the deaf, deafblind, hard of hearing, not just any people with disabilities. Some ILCs have lots of different types of support groups that support people with various types of disabilities, but this was specifically support groups for people with deafness, deafblindness, or who are hard of hearing. Again, an opportunity for some of you who don't have that, or maybe task force. Sometimes it's for task force for people who are deaf with mental health, or task force for people who are deaf with addiction or something like that. So we have different types of task forces for our community members. Number six was basic ILC services. This is what we provide, but we provide them to our deaf community by making sure it's accessible to them, maybe through an interpreting services. There is one ILC who provides and specializes in SSP or support service provision for the deaf blind. There is one ILC who's doing that work. And we'll just jump to the next slide for time. I did want to mention about funding because I noticed that funding varies in order to provide services to the deaf, blind community. So there's a variety of ways and places that they're receiving additional funds to support these programs. And I did want to mention, I think it's important to recognize where the funding comes from. Some of the information collected said that many ILCs, they didn't elaborate on this, but they just said federal or state funding. Without them elaborating, I can't jump to conclusions on what they meant, which type of federal or which type of state funding, but I'll take it for what it is. The second was the New York State Justice Center. The Justice Center hosts the trade equipment equipment loan program. So maybe that's what they were referring to. Some of them said they had no funding. They're really utilizing and taking from their ILC core budget. And that's that total allotment. They're just taking a part of that to support the deaf, blind, hard of hearing services. State education, New York State education, specifically, it was their Access VR, that type of funding, or transition services through Access VR. That's where the funding came from, out of state education. That transition service funding is from WIOA, the Workforce Innovation Opportunity Act, WIOA. There is money there for support services for transition specifically. And ILCs have been creative utilizing some of that money from WIOA to support their deaf, blind, hard of hearing services. Others mentioned that they received funding from the Office of Mental Health. Others said the Association on Community Living, they received money from them, from those types of grants, or maybe fee for service as well. I think most of them are fee for service funding, but and then also Office of Victim Services, OVS. That was interesting to see that they receive funding from OVS. I think crime crime or services to support people who have been victims of crimes. Creative way to get funding to support services. I thought I was quite interested in learning more about that myself. And the last was Community Service Society of New York was one organization that they received funding from to support, or grants, or maybe fee for service. A variety of ways that people are receiving or utilizing funding to support our community members, which is wonderful. We'll go to the next slide. One of the questions we asked was, does your center identify, or have they identified a need for services to the DDBHH community? And here were some of the results. 10 out of the 14 responded that they do identify needs. Clearly, they were able to see the needs in the community. 2 of them explicitly said, we have not identified any needs. We're good. The third I have listed here, one said that they have an advocate who's specializing in this already. I'm not sure exactly how to interpret what they meant by that, but does that mean that they are identifying needs or they're not identifying needs? I'm not quite sure, but that's what they indicated. And one said that they didn't understand the question. I'll leave that one there. Lastly here, they did identify needs in their community. Of course, resources is always up there on the list. They need various resources. Who can they refer to? Where are the community organizations that we can partner with? We need more resources within our region and our communities. The second one was that the deaf community is quite large. The deaf, blind, and hard of hearing population. And I won't say which ILC or which area it was, but they need more funding because they have such a large deaf, blind, hard of hearing community, and they need funding to support all the needs of that community. We need money to support these services, and I understand that. There are, lots of resources that are needed and lots of funding to provide. Again, every single one of them said funding is needed. So I could emphasize that all day long. But yes, we recognize the need for resources and funding. One ILC did say that they felt very overwhelmed in providing services to the DDBHH community because they don't have enough and they feel stressed and overwhelmed by the need of the community. Yeah. Okay, moving on the list here. People have recognized the need. They've identified the need for advocacy and communication to train people on a variety of topics. There's lots of areas that we could provide advocacy. I think ILCs do a lot of that type of advocacy, and they don't necessarily or feel equipped to speak about, to advocate for the deaf community. They see that there's a huge need and need to be able to communicate for the community about all these issues. But I think that they would rather put that on the deaf community to advocate and to communicate about their needs, not doing it for them. Many people mentioned that they would like to hire employees who are community members. Before, some of them said that 7 of them had programs, and 7 of them mentioned that they have people that they can all interact with the deaf community. But many of them also talked about hiring more from the community or who are ASL fluent. I'm not sure how that what that means, if they have one or need more. I see Rachel has her hand up, so go ahead, Blaze.
Yeah, this is Blaze here. We only have just a few minutes left, as we're about 10 minutes to the top of the hour here. And we have a few questions that folks would like answered. So we will make the question, or we'll make the survey results available as best we can. And I'm sorry that we've got to cut this a tad short. One of the questions has to do with enforcing and holding agencies accountable for. Actually, Alex, I'm going to turn this over to you because you're able to be a bit more seamless with the Q&A box than I am.
Okay. This is Alex Thompson. I'm the Director of Advocacy at NYL. So the first question is, what is your plan for enforcing the agency's hire certified hearing interpreters and deaf?
Alex, this is the interpreter. Hang on one second. Before you read the question, would you mind taking down the PowerPoint slide so we have full screen of Chris and the interpreter? Okay, go ahead. And if you can spotlight Liz, the other interpreter, thank you.
There we go. I'll start again on the question. What is your plan for enforcing the agency's hire certified hearing interpreters and certified deaf interpreters? Many agencies use a warm body approach for profit rather than providing excellent service. Many states have regulations requiring certification or licensure, but New York State does not. For example, the New York State court system does not require certified interpreters in court proceedings, and hospitals are not required to hire certified interpreters in the medical field.
So this is Chris here. Thanks, Alex. That was a really fantastic question, whoever asked that. I will clarify, New York State does have no, I will emphasize the zero. They have my favorite word, I always say, or phrase, zip, zero, zilch. We have nothing here in New York State. We have no requirements, no standards for interpreting services. Unfortunately, there's not requirements or mandates for credentialed interpreters. That said, it would require legislation in order for us to mandate certification or licensure. Other states around the US have the ability to enforce because they have passed legislation within their states to mandate a certain minimum requirement for their interpreters. So first we need to pass laws here in New York State, and the community does need to partner very closely with with the state and to establish laws, and then we can therefore require certification. We are not able to enforce anything in our office. We're not an enforcement agency here. It would be nice if we had that power, but unfortunately we don't. And we don't have anything such of that type of an office here in the state. But we need laws passed in order to do that, and we want to work together to make sure that that does happen.
All right, Blaze, here we have time for one more question, and the rest, I will get the rest of the questions to you, and if anyone has any questions directed for Chris, I will provide his contact info in the follow-up email. So we got time for one more, and then we need to wrap it up.
All right, I'm gonna kind of combine these two questions from Maria and Julia because I think they're kind of related to the same topic. are there any plans of adding back deaf specialists in the independent living community? And I think that's connected to a question about, something you mentioned, Chris, that not ILCs have staff fluent in ASL, but they are looking to do that and expand their offerings. So I don't know if you can speak to, I don't know, any future available state funding to support ILCs and ASL efforts.
Sure, this is Chris here. There is no specific plan. That said, the results do indicate the need for more staff to be able to communicate with our deaf-blind, hard of hearing. So I look forward to future conversations with NYL to look for a path forward to make those types of services available and to happen. Maybe some ILCs have watched this presentation today and feel like, wow, we are such a center and we need more support how to make this happen. So again, reach out to our office. We're happy to work with individual ILCs and different centers to identify needs to move forward in that area. I am not a specialist in the ILC world. You are the specialist, so you'll have to help us in this process, but we are happy to support you as well in yours.
That is a perfect note to end on. Chris, thank you so much for this terrific presentation and making us more aware of the Office for the Deaf, Deafblind, and Hard of Hearing. We'll get you any questions that we received in the Q&A box. And for anyone that has more questions, again, the follow-up or the contact info for Chris will be in the follow-up email with the recording and survey. So thank you to the dream team of folks who helped make this webinar fully accessible. We'll be back in October for a webinar that we're a training. It is a new training for the office or from the Office of New Americans June Ramirez initiative. So with that, thank you all very much and have a great rest of the day.